Today, let's understand how the adrenergic drugs are classified. But before that, can you imagine a childhood incident where you were chased by a dog and your heart rate was thumping literally and your bronchus was all dilated, you were gasping for air and your nose which was blocked is all cleared right now, and were you thinking of food at that time? I don't think so, and you were literally mad somehow, and you did not really want to do anything but run away from the dog. So, if you can understand or imagine how a dog chases you, that's basically how the sympathetic system works. That you are literally in the fight or flight mode, and your heart is beating and your blood vessels are literally contracting like hell. So, to understand the drugs, how they are classified, first let's understand the broad classification. So the broad classification talks about pressor agents, where basically the blood vessels are contracted at the same time your blood vessel is contracted, at the same time your heart is thumping, at the same time you're literally breathing for as much as air possible, and then talking about the nasal block which was really cleared out, and your brain was literally stimulated like hell. And that would talk about CNS stimulants, and then you have anorectives, and then you have uterine relaxants. Don't worry, on the long run you will still need some mnemonics to remember them, and I'm here to give you some really non-classical type of mnemonics which is still going to make your permanent memory happen. So first, let's talk about the pressor agents. So the pressor agents literally mean how they are going to act on the blood vessels and then contract them, right? But before talking about the pressor agents, can you imagine like the 1,000 times you have literally understood how the sympathetic system works and still you're not able to remember all the drugs? Well, the reason is because the mnemonics are pretty flawed, and I would like to give a different touch to that. So for the first set of drugs, that is the pressor agents, the mnemonic which I want you to remember is PM enters the den and presses it, right? The PM enters the den and presses it. The P stands for phenylephrine and M stands for methoxamine. Enter would remind us of mephentermine. In den, D would remind us of dopamine, E would remind us of ephedrine, and N would remind us of noradrenaline. So PM enters the den and presses it. So the presses it would remind us of the fact that it is a pressor agent. Now, as our PM enters the den and presses it, and he goes inside to find the BSF of the Indian standard timings. BS of IST will remind us of bronchodilators, right? So bronchodilators would be reminded like BSF of the IST, or border security force of the IST. IST would be Indian standard timings. Now you could also remember along with that, dilate the border like the bronchi. Dilate the borders like the bronchi, right? So the BSF would stand for bambuterol, salbutamol, formoterol, isoprenaline, right? In the IST, I would stand for isoprenaline, S would stand for salmeterol, T would stand for terbutaline. So dilate the borders like the bronchi and BSF of Indian standard timings, the border security force of the Indian standard timings. As you go ahead, you find a person who is stimulating your heart, right? You found the person who stimulates your heart, and that is DIA. The cardiac stimulants can be remembered as DIA, DIA being dobutamine, isoprenaline, and adrenaline. Then you go mad, literally seeing this DIA. Mad would remind us of, you go mad by brain itself, right? Through. So the CNS stimulants would be reminded through MAD. MAD being, before MAD, remember amphetamine MAD or methylphenidate MAD. So when you can remember it as methylphenidate MAD or methamphetamine MAD, you could remember it as basically MAD would be dexamphetamine, amphetamine, and methylphenidate. The extra M would remind us of methamphetamine. Then look into uterine relaxants. So basically in a sympathetic activated system, the uterus will not contract, right? There will be literally uterine relaxation. And so the mnemonic for this would be RISTE. RISTE uterus say, that would be the mnemonic. So RISTE uterus say kind of sounds familiar also. RISTE would remind us of ritodrine, isoxsuprine, salbutamol, and terbutaline. RISTE would be ritodrine, isoxsuprine, salbutamol, and terbutaline. Then talking about anorectics. So for anorectics, it's a combination of mnemonic. So it would be side I am fine without food. Yeah, see they I am fine without food. See they would remind us of, that would be SIDEAMFEN or SIDEAMFINE. See they would remind us of sibutramine. D would remind us of dexfenfluramine. Am would remind us of amphetamine. Fein or fen would remind us of fenfluramine. So see they, yeah, side I am fine without food. Without food will remind us of the fact that you're an anorectic. It's an anorectic. Then lastly, we will have to focus on the nasal decongestants. There isn't a particular mnemonic for this, but all the metazolines, they're pretty characteristics here. The names are pretty characteristic. So xylometazolin, oxymetazoline, nafazolin, phenylephrine, these would be the drugs which are nasal decongestants. So you can remember the PM enters the den and presses it, then he finds his heartbeat, the heartbeater, that is DADIA there, and he makes RISTE with her. Then he kind of goes mad, and yeah, this would remind us of the basic drugs of the adrenergic system, or the drugs which will act on the adrenergic system. So these would also be called as nothing but the sympathomimetics, because they are acting like the sympathetic agonists, or the sympathetic like drugs, sympathetic system activating like drugs. So that would end the adrenergic drugs.